Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I love showing off cases, and this is one that I definitely wanted to show off. There's three main points here. Number one, how awesome it is to close gaps between upper front teeth. It's my favorite thing to do. It is the best thing you can do for somebody's smile. Number two, that orthodontics isn't just about aesthetics. You'll see even in this case that there are some very functional things that we're doing as well. And I didn't even show you all the functional things. We're just going to focus on one of them. And number three is what are some of the things that sometimes we do to increase the stability of our results? So this is Shamyra, great patient, came to us looking for a nicer smile. And here's a little close-up of her teeth. One of the things that I want you to take notice of is how much the upper front teeth are overlapping the lower front teeth in a vertical way. So more than 50%, maybe 60 to 70% of these lower front teeth are being covered by the upper front teeth when she's biting down like this. And it's a little hard to see, but you can just see it as you look at the tops of these lower teeth here. They are flattened out. And one of the reasons why these teeth are getting flattened out is because of how much these teeth are overlapping. These lower teeth are taking bite forces that they're not intended to take, and it's causing these lower front teeth to get worn down. So this is one of the functional things that we wanted to take care of in addition to closing this gap. The third thing that I want to point out is this piece of gum tissue right here. You can see this piece of gum tissue is pink, pinker than some of the areas that surround it. And what this actually is the muscle attachment that comes from Shamyra's upper lip down to her gums. All of us have this muscle attachment. It's called a frenum, but not everybody has the same size and shape of frenum. And so Shamyra's frenum is very, very thick. This is a very thick muscle here, and it comes all the way down to the area between her teeth. If you look in the mirror at your muscle, it probably is not this big and doesn't come down all the way to your teeth. So we went through and we did Shamyra's treatment with braces, and we got the spaces nice and closed, this beautiful smile. You can see that we are seeing much more of the lower front teeth. Now our upper teeth are covering maybe 20% of these lower teeth. And that is helpful because it means that these lower teeth aren't going to take the bite forces that they're getting. They shouldn't be getting worn down. That means later in her life, they shouldn't be chipping and breaking down as we often see in our adult patients. We've got our space completely closed. And look, we don't see that piece of pink gum tissue up here anymore. Shamyra, after we closed the spaces, had a frenectomy. It's a little procedure to remove part of that muscle attachment. And that muscle attachment is really the reason why she had a gap between the two front teeth. And so we're hoping that this adds to the stability of her results, making it less likely that this space ever opens up in the future. Now, of course, we also have retainers to hold the teeth in their places, but that frenectomy is, again, addressing the reason why that space exists. And so really, because of how thick that muscle was, really wanted Shamyra to pursue a frenectomy. Here's her smiling at the end of treatment. What a beautiful smile. She love seeing this. And when you see the difference between where she started and where she is now, again, you can see the functional difference in terms of how much the upper and the lower front teeth overlap. You can appreciate the space closure, and you can see the difference in that muscle attachment. So all great work here. So, and then here's the before and after with the smile. Again, we watched this young lady grow up before our eyes, and what an awesome smile you have, Shamyra. I'm so happy for you. You deserve this, and I really just want you to go and show the world this smile, show off your personality. I'm very, very pleased. And so here we are celebrating at the end, and she's holding up a picture of where she started just as a remembrance of how far she came. And so when she saw that picture, she was like, oh my goodness, I can't believe that's what I look like. So great smile, Shamyra. Thanks for being an awesome partner in treatment. We're so happy for you. If you or somebody that you know has a gap between their teeth that they'd like to see closed, please, we'd love to help them out. It is the most gratifying thing to see somebody smile big and confidently after we've done this kind of work. Frenectomies are not always required after space closure, just in certain cases when the muscle is very thick and large. And yeah, the functional changes, we will advise any patients of what we can do to make their bite healthier. All right, if you have any questions, please let us know. Thanks for listening.